The action potential is a rapid increase and decrease in voltage, which is caused by changes in ionic permeability. In a typical action potential, the rapid increase in voltage occurs as voltage-gated sodium channels open, then the rapid decrease in voltage occurs as voltage-gated sodium channels inactivate and voltage-gated potassium channels open. Importantly, an action potential propagates along the axon as depolarization in one segment of membrane triggers an action potential in adjacent locations.
The action potential waveform is a rapid change in transmembrane voltage and is characterized by 4 distinct phases. The rising phase and overshoot approach the equilibrium potential for sodium, while the falling phase and undershoot approach the equilibrium potential for potassium. In contrast to the resting membrane potential, the action potential is generated by voltage-gated channels. Voltage-gated channels have charged subunits that allow them to open up when the membrane potential becomes more positive. In reality, depolarizations from rest are due to synaptic currents. However, we can also use electrodes to artificially depolarize neurons. Voltage-gated channels selectively permeable to sodium are the first to respond to depolarizations from rest. Sodium current flows in and moves the membrane potential towards sodium's equilibrium. Voltage-gated sodium channels have a blocking particle tethered near the pore, so once opened, they rapidly inactivate and are only reset by a repolarization to rest. This is important since more depolarization opens more channels, providing more paths for current to flow, or conductance, which opens more channels, etc. This positive feedback loop would keep neurons close to sodium's equilibrium potential if they did not block. After a short delay, voltage-gated channels selectively permeable to potassium respond to membrane depolarization. The driving force for potassium is high this close to sodium's equilibrium, and so potassium current flows out, moving the membrane potential in a negative direction toward potassium's equilibrium. This leads to a decrease in potassium conductance as voltage-gated potassium channels begin to close, functioning like a negative feedback loop, thus no blocking particle required. The repolarization also allows for voltage-gated sodium channels to become unblocked. For this reason, these potassium channels are known as delayed rectifiers. Because voltage-gated sodium channels are responsible for the rising phase and overshoot, and delayed rectifier potassium channels are responsible for the falling phase and undershoot, spike threshold is defined as the membrane potential at which sodium conductance exceeds potassium's, setting off the rapid positive feedback loop. Similarly, a refractory period is created following a spike when insufficient numbers of voltage-gated sodium channels have repolarized and reset to cross threshold.
In introductory classes, you learned about the action potential. But neuroscience is an interdisciplinary field, so there are many words for this term. For example, it might also be called a nerve impulse, a neural impulse, or electrical impulse, and this term may be shortened to just impulse. You may also hear the term spike and a series of action potentials referred to as a spike train. So action potential, spike, and nerve impulse may all refer to the same thing.
The action potential is important in almost every aspect of neural communication, including sensation, motor control, and cognition. For example, did you know that many anesthetics reduce pain sensations by blocking the propagation of action potentials? The pain-reducing solution that a dentist injects near the teeth contains chemicals that block the voltage-gated sodium channels. And this technique, which is called local anesthesia, stops your sensory receptors near your teeth from sending signals to your brain. Recall that voltage-gated sodium channels are responsible for the rising phase of an action potential. When the voltage-gated sodium channels are blocked, somatosensory neurons near the teeth are still depolarized by mechanical stimulation. However, no matter how large this depolarization is, action potentials cannot propagate when the voltage-gated sodium channels are blocked. This means sensory signals never reach the brain, and therefore, you feel no pain.
Now that you've had some review about the action potential, let's see if you can follow along with this example where I model an action potential before and after the permeability of the delayed rectifier channels is decreased. Okay, so let's start with the before condition first. What we have here is a typical action potential. The rising phase of this action potential is driven by the opening of voltage-gated sodium channels. And as these channels open, they increase the permeability to sodium, and the voltage across the membrane will move towards sodium's equilibrium potential. After about a millisecond or so, the voltage-gated sodium channels will inactivate, And after that point, there would no longer be sodium current across these channels. With a brief delay, the voltage-gated potassium channels, also called the delayed rectifier channels, will open. And this falling phase and also undershoot of the action potential are driven by the opening of these voltage-gated potassium channels. Okay, so that's our typical action potential. And then the question is, what would happen if we reduced the permeability of these delayed rectifier channels? In order to tackle that, we'll think about this one step at a time. During the resting potential, the delayed rectifier channels were not open anyways, so reducing their permeability will not affect rest. Similarly, the delayed rectifier channels were not open during the rising phase, so reducing their permeability will not affect the rising phase either. It's during this falling phase of the action potential when the delayed rectifier channels would be open, and if we reduce the permeability, then the membrane potential will drop less rapidly. So we might see something like this. And in addition to the fact that the voltage would drop less quickly, you'll also notice that I've drawn here that the undershoot is not as deep as it otherwise would be. And this again derives from the fact that fewer potassium channels are open, and therefore the voltage across the membrane does not get as close to potassium's equilibrium.